Hi, thank you so much for joining me today. Over the next couple of weeks, I'm going to be talking about compassion fatigue and burnout in the veterinary profession. It's something that we do struggle with a lot in our field, and I want to address it and sort of talk about what it is and what you can do to help, whether it's for yourself or for your team members. And I feel that it's something that it's sort of being talked about a lot in different areas, but I want to make sure that you guys understand and have the tools to work with it better. And hopefully, I can help you with a problem that you might be dealing with. So, first of all, what is compassion fatigue? Compassion fatigue is sort of known as the cost of caring. It is something that we feel like we don't care as much. We've cared so much and for so long that it's hard for us to care anymore. And it's a combination of secondary traumatic stress as well as burnout. And secondary traumatic stress, although that affects us a little differently in our field, if you were like a human psychiatrist or nurse or something, then working with human patients, then the secondary traumatic stress is if you're hearing a story about something traumatic that happened to a person, you start to feel like it happened to you, or you feel the effects of it, even though it didn't happen to you. And the concept of secondary traumatic stress is that you don't actually have to be affected by the trauma to feel the effects from the trauma. And that is basically what secondary traumatic stress is. And burnout is a lot of times the stress of dealing with repeated problems, struggles, concerns repeatedly over and over and over. A lot of times it applies to your job or your workplace or even your career, but it also can apply to you on a personal level as well. But most of the time it is dealing in the workplace. So the combination of both secondary traumatic stress as well as burnout is what leads to compassion fatigue. And so what I want to talk about are some of the basically symptoms of compassion fatigue. And I'm talking to you guys about this now because I really, really, really want you to have a good understanding of what to look out for when you're thinking about, is someone on my team struggling from compassion fatigue? And you might ask me, like, well, why are you talking about this? Well, last year I became a certified compassion fatigue professional. And even though it's not specific to the veterinary field, it absolutely 100% applies to us and the things that we do. And over the past, for I guess 15 or 16 months now, I've been giving presentations and doing training on compassion fatigue in veterinary hospitals. And so I feel like I do have a really good understanding and a really good passion to help others work through this problem. So, and you may ask me too about why did you pick these skydivers as your background? And I feel like there's two things. One, I think this is amazing that any person is willing to jump out of the plane and can do it in a formation. And I feel like that's a solid show of teamwork right there, right? Teamwork, yay. But the other thing is, I feel like sometimes when we're struggling, whether we're struggling with burnout or we're struggling with stress or compassion fatigue, we kind of feel like these, skydivers. We kind of feel like we're just free for all, just flying through the air with no point or no direction. And I kind of feel like that's sometimes how we feel. And I know I've felt like that myself. So I can understand how many of you may feel like that as well. So let's talk a little bit about what are some symptoms of compassion fatigue. And I'm just going to talk about compassion fatigue today. And in the next few days, I'm going to give you guys some tools to deal with compassion fatigue on an extent. I'm going to be interviewing Lori. She is a breathworks specialist, and breathworks is basically learning the art of breathing to help you deal with problems and stress in different situations. So we're going to talk about a little bit of problems now, and I'll bring you some solutions a little bit later. So one of the first signs of compassion fatigue is starting to have sleep problems, insomnia. And I think insomnia and sleep issues are not just for compassion fatigue, but they absolutely can be a part of compassion fatigue because sometimes it's really hard to just kind of turn your mind off. You can't shut your brain down for all of the problems and struggles that you've had throughout the day. And that makes insomnia really difficult. And I can tell you right now, as a veterinary professional, I've suffered from insomnia off and on for many years. I feel like today I'm in a much better place than I have been in the past, but I 100% know what it's like to have sleep problems. I 100% know what it's like to close your eyes and not be able to turn off your brain. And sometimes you see images you don't want to see. You know, working in our field is very difficult and it's absolutely emotionally exhausting and draining. And that can definitely manifest itself in having insomnia and sleep issues. So that is definitely one of the symptoms of compassion fatigue. Another symptom of compassion fatigue is kind of isolating yourself. If you start to feel like you just want to be alone, you don't want to be around people, especially if this isn't normal for you. You know, if you normally do like being around people and now you kind of start to feel self isolating, you know, that is a sign and it's another symptom of compassion fatigue. And when I go through these lists of symptoms, I want you really, if you're, especially if you're a leader, I want you to think about looking at if some of your team members are struggling with this or if you yourself are struggling with these things. Another one is starting to self-prescribe. And that can be, you know, with medication or with alcohol or other drugs. I know sometimes even gambling can be a symptom of compassion fatigue and trying to deal with just shutting off the pain and shutting off the feelings. And I know that it's normal for many people to just have a glass of beer or wine or whatever, but you know in yourself if you're drinking too much or if you're medicating yourself too much, whatever that medication is. I don't necessarily mean illegal substances, but you know whether this is something that you're doing now that you might not have done when you felt a little bit differently or you felt better. So you really want to look at that. Is this a problem? Because I obviously don't know. I don't know you. So I don't know if it's a problem for you or not. But self-prescribing can absolutely be a symptom of compassion fatigue. And loss of productivity is also a symptom, especially if you're not sleeping very well. It's really hard to be productive when you're not sleeping well, right? And you're also starting to have this kind of, you've lost your motivation. And when you start not to care, you know, like I said, compassion fatigue, one phrase for it is the cost of caring. And that makes it really hard to be super productive if you don't care anymore and you're tired of caring, you're burned out, you know. I feel like that is definitely something that starts to show up in your work performance and how you're dealing with your days and how you're doing things. And unfortunately, a lot of you guys will know this is another symptom of compassion fatigue is GI distress. So I know that's probably not something fun for you guys to think about, but do you start to feel like you're developing an ulcer? Are you starting to have really bad stomach issues? Are you nauseous a lot? Do you have other GI issues? You know, maybe the other end. Those are definitely things to look out for if you're starting to experience. And once you start to write down what you're experiencing, if you find yourself, I have more to go over with you, but are you really noticing you have a lot of collective problems and collective struggles that can indicate that you're absolutely suffering from compassion fatigue? A lot of times some people start to suffer from poor concentration, especially again if you go back to that sleeping thing. I know when I don't sleep that well, it's really hard for me to focus the next day. Not only am I not that driven because I'm really tired, I also have a hard time remembering things. I'm not able to concentrate or focus like I'd like to. It's absolutely something to sort of be aware of whether you're experiencing that or not. And I think another thing to really think about, I think a lot of times we kind of tend to focus on the negative more than the positive. But if you're the kind of person who normally has a good attitude and you find yourself frequently complaining about things, sometimes that is a direct result of suffering from compassion fatigue. And are you experiencing a feeling of chronic dread? I know over this past year with COVID, we 100% were feeling dread all the time. It was awful. Like I have a whole presentation on COVID because it was just an awful time. And I say was, even though I know we're still experiencing it, I feel like most of us have started to see that light at the end of the tunnel. So hopefully we're not having that same COVID dread. But if you're feeling dread on a different level, if you're dreading to go to work every day, you know, I want you to really look at why. And maybe you need to put it in writing. Just write a sentence of, I don't want to go to work today because, and you need to see what you say. What is the reason for your dread? A lot of times our compassion fatigue can sort of present itself in being passive aggressive. and making comments under our breath or making comments in a very passive aggressive manner. And leaders, this is something for you guys to really think about. If your team is being very passive aggressive with you, what's going on? I'm not going to assume that to jump that it's always compassion fatigue, because there absolutely can be other things. But if you're someone who's not normally passive aggressive and you are now, it's again something you really need to think about. And what about having a lot of anxiety and fear? That is something that some of us do struggle with, anxiety and having anxiety problems. And can that be related to compassion fatigue? Yes, it can. Does it mean no? It doesn't mean automatically, but it is absolutely something that can be a factor. And are you starting to hate your job? A lot of us do start to get really burnt out, and we start to feel like we just can't care anymore, and we start to hate going to work. And you really need to identify that is if you're feeling that way because you're struggling and suffering with compassion fatigue. And do you feel like you've lost meaning and purpose? I know myself, I have a very different purpose than I did, 10 years ago in this field. But I also know that I haven't lost it at this moment. I have struggled with compassion fatigue in the past very tremendously. And now I've come like full circle and I'm in a different place. But maybe you're not. Maybe you're still feeling like you've lost your purpose. That's a huge sign. It's a huge sign that you might want to get help with that. And we're going to talk about that in just a moment. And another thing is being really reactive. Are you really reactive to things maybe you weren't before? Are you snapping at people? Are you making quick decisions? Are you reactive in usually a negative manner, not necessarily a positive one? Then absolutely that is a sign or can be a sign of compassion fatigue. Having racing thoughts, you can't control your thoughts, you can't shut them down, you can't shut them off. That's again leading to some of the sleep problems. You have to figure out what are those racing thoughts, what are they doing to you, and why are you having them? I think the why is very huge. Have you become very cynical? I've worked in veterinary, or I'm sorry, in emergency medicine for 5, going on 6 years. And I've seen what happens to some people over the years. They become extremely cynical. And some of that is dealing with your job, because emergency medicine is very difficult and it is very emotionally draining at times in a different manner than non-emergency medicine is. And I see how people can become cynical. And you've got to think about, is your cynicism because you're just dealing with shutting down those emotions, or is your cynicism relating to something else because you're just tired of caring about it? And I think the last thing that we struggle with in our field in compassion fatigue is having suicidal thoughts, suicidal feelings. And we obviously know our field has a really high suicide rate. And so we need to sort of address that, whether that's for yourself or for others, for your friends, even your family, for your team members, if you're a leader. That is absolutely something that we need to talk about. We need to normalize it. Not that it's a good thing, I don't mean that, but I mean we need to normalize the conversation and be comfortable having the conversation of asking someone if they're okay. And these are just some of the symptoms of compassion fatigue. There's more when you start to look at secondary traumatic stress and when you start to look at burnout. These are just some sort of general symptoms and feelings that we have, or experiences that we may have if we're struggling from compassion fatigue. And I wanted to talk about those with you so you guys can be thinking about that, especially if you're a practice owner or if you're a manager and you're leading a team of people. You need to help them. It is your job as a leader to help your team. I know sometimes people don't want to hear that. They don't want to hear that they have a responsibility, but guess what? You do. The moment you become a leader and have people you're responsible for, you have to help them when they're struggling. And you have to be willing to look at if they're struggling or not. And you have to be willing to ask the question. Something that I will mention multiple times over the next few YouTube sessions is you should really, really have an employee assistance program. So an EAP program that can allow your employees to get help when they need it. And you shouldn't just put it up as a sign or hand it out to them when they first get hired. You need to talk about it. In every team meeting, you need to talk about if people are struggling. And you need to talk about those struggles, not necessarily on a personal level, because people are not necessarily comfortable with that, but letting them know that it's okay to use that EAP. That's what it's there for. There's a lot of different programs out there. I'm going to try to see if I can link some into my YouTube channel so that you guys can get those, get the information. You can check with your health insurance program. You can check with your workers' comp insurance to see if they have a connection. If you have a broker, you can see if there's a program that might work for you. And I will, like I said, try to put it on my YouTube channel. So hopefully this information wasn't too sad and too draining, but hopefully it was helpful to you to understand what is compassion fatigue. What are the symptoms of compassion fatigue? We're going to talk about secondary traumatic stress. We're going to talk about burnout in the next couple of YouTube videos. And the next video I'm going to do is going to be on breathworks. Again, as I mentioned, Lori is going to come on, Lori Shaw, and she's going to come on and help us with learning if you're struggling from some of these stressful feelings, what can you do about it? I have a lot of really good tools I'm also going to be talking about in further YouTube videos. So please join me. Please like or subscribe to my channel so that you can get all the information as it comes in. And I hope that you guys can help your team and help them deal with these problems, because I guarantee you, I belong to several management groups, several Facebook management groups. I interact with hundreds of veterinary managers and veterinary professionals, and compassion fatigue is real, and it probably is in your hospital, even if you don't want to see it. So I really hope you guys go in with an open mind and you can help your team grow with this and help them get out of this or help them deal with the struggle. So again, please like or subscribe my channel, South Coast Veterinary Management Solutions, and please, please, please join me in the future as I do more YouTube presentations for you. And if you're interested in having me come to your hospital and do a personalized training for your specific team, feel free to email me at southcoastvetsolutions@gmail.com. You can also check out my website. Feel free to reach out to me. I do personalized training for each individual hospital, so it is specific to your group of people and not a generic training presentation. So please feel free to reach out to me. Again, thank you so much, and please like and subscribe my channel. Thank you.